Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and Flex and OET training. In the last class, we discussed about nursing foundation models, and this class we are going to discuss about legal aspects. That is also from what nursing foundation. See, definitely from these two areas you can expect question in the exam. So don't forget to revise this topic before going to the exam. Okay, so let's begin the session. So legal and ethical aspects in nursing, it is coming under nursing foundation. And if you like the video, please like it, share it, subscribe it. And those who are watching without subscribing the channel, please subscribe the channel. It will be acting as a motivation for us. Okay, so let's begin the session without wasting the time. The first question what we are going to discuss is the phenomena of a nurse respecting a patient right to make a decision is called as. Direct question. Here the key point is the nurse is respecting the patient right to make the decision. So the patient is making the decision and as a nurse you are accepting it. ஒரு பேஷண்ட் வந்து ஒரு டெசிஷன் எடுக்கிறாங்க, நீங்க வந்து அந்த டெசிஷன் பேஷண்ட் எடுத்த டெசிஷனுக்கு ரெஸ்பெக்ட் கொடுக்குறீங்க, அக்செப்ட் பண்ணிக்கிறீங்க. ஸோ தீஸ் கீ பாயிண்ட்ஸ் ஆர் பிரசன்ட் மீன்ஸ் யூ ஹாவ் டு திங்க் அபவுட் இன்டிகிரிட்டி, ஹியூமன் டிக்னிட்டி, altruism or autonomy. So which is the right answer here? The right answer here is option D, that is autonomy. Okay, fine. So why I selected autonomy? Before that, let's discuss about the altruism. Okay, that is one of the option. Option C is altruism, but that is not your right answer. But still, you should know what is meant by altruism. Altruism, it is a principle and practice concerned for the well-being and happiness of other humans or animals. Okay, above oneself. நம்மள பத்தி யோசிக்காம மத்தவங்களுக்காகவே வாழ்றது, மத்தவங்களுக்கு ஹெல்ப் பண்றது, அது அனிமல்ஸா இருந்தாலும் சரி, ஹியூமன்ஸா இருந்தாலும் சரி, we are helping others. Whether it is a human or animal, doesn't matter. We are focusing on helping others. Here you can see the images. As a father and mother, you are helping the children. As a pet keeper, you are helping the pets. As a person, you are donating everything to the peoples who are all poor, and you are helping the old age peoples. Okay, so you are doing good for the others but without thinking about yourself. Okay, that is called as what? Altruism. Okay, fine. So the next very important thing what we are going to discuss is we are going to discuss everything related to what? Legal and ethical aspects. Okay, for this question the right answer is option D. In the next slide we are going to discuss all the legal and ethical aspects. See, in short, it is called as what? Ethical principles. There are many ethical principles. One by one we are going to discuss. Please listen carefully. Definitely you can expect a question from here. So many times they asked questions related to this ethical principle, so it is very, very important topic. The first one what we are going to discuss is justice. Just remember the key point. Justice means if there is a resources, equally distributing the resources to everyone without any partiality. You are having 50 rupees means 5 people are there, 5 poor people are there, means for each person 10 rupees. Okay, so 50 rupees is covered. So equally whatever the resources is available, you are distributing to everyone. That is called as what? Justice. Okay, so here you can see fairness to provide care, that is just an equitable and evenly distributed. Whatever the resources is available in the scarcity. Scarcity means adequate illada time la kuda என்ன ரிசோர்ஸ் அடிக்குவேட்டா உங்ககிட்ட இருக்கும். ஸ்கார்சிட்டினா கொஞ்சமான ரிசோர்ஸ் இருந்தாலும் அதை வந்து ஈக்குவலா வந்து டிவைட் பண்ணணும். அதுதான் வந்து ஜஸ்டிஸ். ஓகே, the next one is beneficence. Doing good for the clients. Okay, doing good for the patients. That is called as what? Beneficence. This is the key point. Okay, the next one is non-maleficence. That is not doing any harm to anyone, whether it is intentional or unintentional, doesn't matter. You are not at all doing any harm to anyone. That is called as what? Maleficence. See, all the points are very, very important, guys. இதெல்லாம் கண்டிப்பா ஞாபகம் வச்சுக்கோங்க. கண்டிப்பா இதுல வந்து क्वेश्चंस வரும். சரியா? So frequentா இந்த மாதிரியான ethical principles, models of nursing care, that is we have seen in the last class. So இந்த ஏரியால இருந்துலாம் பாத்தீங்க அப்படின்னா 90% கொஸ்டின் வரதுக்கான சான்சஸ் இருக்கு. ஸோ டெஃபினட்டா நீங்க இதெல்லாம் வந்து ரிவிஷன் பண்ணிட்டு தான் எக்ஸாமுக்கே போகணும். சரியா? ஸோ நெக்ஸ்ட் ஒன் இஸ் அக்கௌண்டபிலிட்டி. அக்கௌண்டபிலிட்டி மீன்ஸ் வாட்? வி ஆர் ரெஸ்பான்சிபிள் ஃபார் த ஆக்ஷன் வாட் எவர் வி ஆர் டூயிங். எது நம்ம பண்றோமோ அதுக்கு நம்ம தான் வந்து ரெஸ்பான்சிபிள். ஓகே, ஃபைன். ஸோ ஃபிடிலிட்டி. Fidelity means keeping promises, being true to the profession. Okay, keeping promises is the key point. Okay, most of the question it is related to the word keeping promises. So keeping promises or true to the profession, if these words are coming means you have to think about what? Fidelity. The next one is autonomy, means allowing the patient to take the decision on its own and you are respecting and accepting the decision whatever the patient has taken. Patient வந்து நீங்க decision எடுக்கிறதுக்கு allow பண்ணணும். So அவங்க எடுத்த decision நீங்க respect பண்ணி accept பண்ணிக்கணும். Okay, so that is called as what? Autonomy. The last question இதுதான் நம்ம பார்த்தோம். சரியா? Autonomy. The last one is veracity. Veracity means telling the complete truth. Well, even though it is unacceptable, but still you are saying the truth. Okay, so truth is the key point. So if the truth key point is there, means definitely you have to think about what? Veracity. Okay, so these are all the ethical principles. Definitely you have to remember. Same like a tables. Okay, fine. The next one, related to these ethical principle, whatever the question they have asked so far in the exam, those questions we are going to discuss now. Already I discussed the meaning of each and everything. Then now you have to think about the answers. Okay, so let's see the questions which is related to our discussion. Do no harm is which ethical principle? Do no harm, very simple. Okay, so direct question, veracity, beneficence, non-maleficence, justice, and here the right answer is what? Option C, that is non-maleficence. Okay, doing no harm is non-maleficence. Justice means whatever the resources available, you are sharing to everyone. Beneficence means doing good to others. Okay, fine. So the next question is, which ethical principle refers to doing good to the patient? Here, which is the key point? Doing good to the patient. So here, which is the right answer? Come on. So option C, doing good. These two words is present, means you immediately you have to think about what? Beneficence. Not harming, non-maleficence, and doing good is beneficence. Okay, which of the following refers to keeping one promises? Keeping one promises, just now I discussed about this. So fidelity, non-maleficence, beneficence, veracity, and here the right answer is what? Fidelity. Promises, this word is coming, means this key point is there, means immediately you have to think about what? Fidelity. Okay, the next one is, I have given the explanation also. The ethical principle that obligate faithfulness, commitment, responsibility. Okay, commitment, responsibility, truthfulness. So these words are coming, means what? Again, fidelity. Okay, again what? Fidelity. So two questions we have discussed which is related to fidelity. The first one is what? Keeping one promises, that is also fidelity. Again, different way they ask the same question. Okay, faithfulness, commitment, responsibility. Okay, keeping promises, then again what? Fidelity. Okay, so the next one is the principle of telling the truth. Truth is the key point. If the principle of telling the truth and not mislead the patient is called as what? Truth means veracity. Truth means what? Veracity. Okay, fine. So the next question, allocation of resources involves which of the following ethical principle? Here, which is the key point? Allocation of resources. Okay, so allocation of resources, if these words are coming, means immediately you have to think about what? Justice. Okay, so I have given each and everything, means in the meaning when I am discussing the second slide, each and every ethical principles and meaning we have discussed. If you understand the concept, if you know the key points whatever I have discussed now, so it is easy for you to solve the questions, otherwise it will confuse you. Okay, so do the revision again and again. So thank you very much for watching the video, guys. If you have any doubts anywhere, please drop your message in the comment section, and if you like the video, please like it, share it, and subscribe the channel so that it will be motivating for us. Thank you very much once again.